Good morning, and thank you so much for giving us the opportunity to come and visit you. I'm working with ocular oncology, so I will talk a bit about the treatment of retinoblastoma. Retinoblastoma is the most frequent malignant intraocular tumor in children, with an incidence of about 1 out of 15 to 18,000 births. It's unilateral in 60% of the cases and bilateral in 40%. The median age at diagnosis is for the unilateral cases 24 months and for the bilateral cases 12 months. In Sweden, all the patients with retinoblastoma are referred to us in Stockholm, and in Sweden we have about 6 to 7 new cases per year. We work in a multidisciplinary team with ocular oncologists, nurses, social worker, pediatric oncologists, and neurointerventionists. In the past, external beam irradiation therapy and enucleation were the only treatments available for those children. But about 15 years ago, one wanted to try another treatment because we wanted to see to avoid the side effects, mainly from EBRT, and of course preserve the vision. So systemic chemotherapy in combination with local laser treatment were introduced. Of course, brachytherapy and diode laser or cryotherapy is also available for small tumors. But I'm going to focus the rest of the talk for two fairly new treatments, intravitreal chemotherapy and intra-arterial chemotherapy. Intravitreal chemotherapy is a method that you can use when the children has vitreous seeds, that is, tumors spread in the vitreous, which until now has been the main challenge in the treatment of retinoblastoma. Before, you had to enucleate or irradiate the eyes. But now it's possible to give a chemotherapeutic agent directly into the vitreous, and the drug which is used is melphalan. And here is a boy that he had a bilateral retinoblastoma. He had formerly been treated with systemic chemotherapy in combination with laser, but then he developed these vitreous seeds, and after 5 injections, the vitreous was completely clear. Then I'm going to continue to talk a bit about intra-arterial chemotherapy, a method that was introduced in Japan more than 20 years ago. But in Europe and in the States, we were a bit reluctant to use this treatment. But about 7-8 years ago, Professor Abramson in New York started to use a modified type of this treatment. So today, more than 2,500 treatments has been given worldwide in more than 30 countries. And the goal, of course, is to try to reduce the systemic toxicity, reduce the risk of drug resistance, and it's possible to give a much higher doses directly to the tumor. And of course, it's a treatment that we do to try to, again, reduce EBRT. So, how it's done? A catheter is introduced in the femoral artery and pushed all the way up to the arteria ophthalmica, and the therapeutic agent is injected directly into the ophthalmic artery. During the procedure, it's possible to view exactly where you are. Sorry. So you can see exactly where the catheter tip is and where exactly the drug is injected. So how is the treatment efficacy of this treatment? In the right box, in the box to the right, you see the treatment success rate for other centers. And we have treated 5 patients so far, and we have 2 other children under treatment for the moment. And we have only treated children that are above 3 months old, and of course where we thought that the eye had a vision potential. So to the left here you see the classification of the children that we have been treated. They are according to the international classification, which are from group A to E, where E are the most severe tumor. 3 of the children had former treatment because they had bilateral tumor and had, because of that, been given by systemic chemotherapy. These are the abbreviations for the chemotherapy. 2 children had not received any treatment before. They were unilateral cases. And here you see if they had any family history or not. And we had a quite good success rate. 4 of these patients went very well. But the 5th boy, he received a toxic effect to the orbit. So he had an inflammation in the optic nerve, and we finally had to enucleate that eye. So I'm going to show you some pictures. This was one of the unilateral cases without any former family history, which had a large tumor in the lower part of the eye. So this is before and after. He received 2 intra-arterial injections, and this picture is now after 1 year without any signs of relapse. This was a girl, 12 months old, with a group D tumor that you can see is adjacent to the optic nerve. And she received 3 treatments, and now she looks like this. So she also responded very well to the treatment. This was a girl with a bilateral case, and she had received systemic chemotherapy in combination with laser and had a very nice flat scar. But then all of a sudden, quite long after the systemic treatment, she developed a relapse at the tumor border here. And she received only 1 intra-arterial injection, and after that she looks perfectly fine. So which are the side effects with this treatment? Neutropenia is reported, and we had 1 child that had a fever, but that normally requires no treatment. You can also, of course, have local complications where you go into the femoral artery with hematoma and thrombosis and ischemia, but that was nothing that we saw. Stroke is, of course, an important side effect, but no cases has been reported worldwide. Vascular spasm, we had 1 patient, but that was transient after treatment. Eyelid edema and rash, 2 patients, but that was also transient. And you can also have vasculopathy in retinal choroidal vessels. We didn't have that among our patients, but that can be due to the toxic effect, vascular effects from the catheter, and embolus from foreign material. And then, of course, you should always think about the radiation-related side effects, since you irradiate the child while you are giving the drug. And, of course, especially in children with constitutional mutations. So our conclusion that we have only been treated 1 child with this intravitreal injection, but it was very effective. And when it comes to the intra-arterial chemotherapy, perhaps one should be a bit careful with the children that has been treated before, as our child that had been treated with both systemic chemotherapy and with irradiation therapy, and then developed this toxic effect on the orbit. Caution should also perhaps be made when it comes to treatment of children with bilateral disease. And it's important to place the catheter in the ostium to the ophthalmic artery in order to prevent spasm or thrombosis. Thank you.